Come on, fill on in. Good morning, everybody. My name is Keith Nahigian. I'm one of the founders of the Great American Health Alliance. We were created to support President Trump's vision of improving health care. We want the patients to have more control over their health decisions and choices. A lot of talk has been done around ACA subsidies. You know, that's about 6% of what the population has. Our movement is really trying to give something to everybody, how to improve health care for everybody. Back in January, we conducted a poll with the McLaughlin Group, trying to see where things rested, and it was amazing. The results were 81% of the voters agreed that the current healthcare system was really just built for people that were sick care as we call it, and that wasn't good enough. 80% of the people intensely, and this is very bipartisan, believe that it's important to improve individuals, families, and more control to shop and make their own choices. Our group has since done polling memos, strategy memos, and we're up on the air right now with an ad featuring President Trump himself calling on Congress to win on health care. Reconciliation 3.0 is a generational opportunity for this nation. Some of us have been working on this issue for 30 years, and there's an opportunity to give the people the power to make their own decisions. I'd like to thank several people who helped create our coalition earlier this year. Health Equity, Alliance for Healthcare Sharing Ministries, the HSA Coalition, Open Loop, the American First Policy Institute. We also have several supporters here today, including Hims and Hers, Eric, the Washington Health Innovation Council, the Heritage Foundation, Americans for Prosperity, Americans for Tax Reform, Council for Better Health, and All Better Health. Special thanks to Eric Burlison, who is the host of today's event and has been our biggest champion and leader on this subject, tying together a lot of legislation on the Hill into one big package, and he'll be able to talk about that. We have a great lineup of House members and a couple of newsmakers. One, AFPI is going to be rolling out a major announcement today, and also we have the Heritage Foundation here to discuss some details on how to pay for this. We also have Katie Talento, former White House advisor, just to give some counsel on how Congress can act quickly and deliver for American people. I'd like to thank, if you'd like to follow us online, we are at the greathealthalliance.org. With that, I'd like to introduce Congressman Burlison from the great state of Missouri.
Thank you, Keith. Good morning, and thank you to the Great American Health Alliance, our coalition partners, and everyone here who refuses to accept health care, this disastrous health care, as the status quo. 16 years ago, Obamacare became law, and for 16 years, Republicans in Congress have promised the American people that there is a better way. Congress has had blueprints, they've had white papers, they've had repeal votes, but unfortunately, Congress ultimately has never delivered. The families of America have waited long enough, and that's why I'm proud to stand here today for the Great American Healthcare Plan. It is our chance to stop making promises and finally give Americans a real alternative. A real market lets people see prices, compare options, and take their business elsewhere. That is not how healthcare works today, unfortunately. Since 2000, overall inflation has risen by 93%. But healthcare inflation has risen 281%. That's 3 times normal inflation, crowding out every available dollar from the Americans' pocketbooks. Only about 2% of hospital revenue comes directly from patients' dollars. The people are paying the bills, but they're barely treated like customers. Washington has gotten very good at protecting the people who profit from this maze. The lobbyists, the middlemen, the bureaucrats, they all have a seat at the table, but families paying the bills do not have a seat at the table. It may be politically easier to protect a complicated system than to take it on. But that is not why we were sent here. The Great American Healthcare Plan puts President Trump's vision into law. It gets bureaucrats and middlemen out of the way, put Americans in control of their healthcare dollars, and let the free enterprise do what it does best, which is actually work. It expands healthier spending accounts, requires plain English prices before people actually get care, uses competition to lower prescriptive drug costs, and gives families the freedom to invest in prevention and wellness. There's no honest message that's against this plan. No Republican or Democrat could go home and tell their constituents that I fought to keep prices hidden from you. I fought to keep your healthcare dollars out of your hands. That is not a message, it's an admission of guilt. But Reconciliation 3.0 gives Congress a vehicle and a chance to move this great bill forward and become law. Think about it like a football game. We have this one chance. We're in the fourth quarter. We're down by a touchdown with just 2 minutes left. For 16 years, Congress has stood on the sideline drawing up plays. Now the American people have put the ball in our hands. This is not the time for another timeout, another white paper, another excuse. We need to call the play, or we need to execute. We need to pass the great American healthcare plan and go win the game. The question is no longer whether Congress has a plan. We obviously have a plan. The question is whether Congress has the spine to actually act. The clock is running out. The 2-minute warning bell has begun. Let's begin this work. And I want to thank everyone for being here and want to introduce my good friend, someone I consider a mentor, who much of the bill, the brilliant parts of this bill, I give credit to, and that is my good friend and colleague, Chip Roy.
Thank you, brother. Appreciate it. Well, thanks, Eric. Can't think of a better champion to take on this issue than my good friend Eric Burlison, who's one of the most principled and solid human beings that I know, not just in Congress, but in general. I want to thank Keith. I want to thank all of the folks that worked to pull this together. I'm not going to repeat what Eric said. You know, in Congress, it's, everything's been said, but not everyone said it, right? I want to avoid that. I do want to rewind the clock for a second. The reason I ran for Congress 8 years ago was multiple issues, but primarily, and number one, was health care. I was diagnosed with stage 3 Hodgkin's lymphoma in 2011. I went through the healthcare system. I was blessed to be able to do so. But I've watched so many of my constituents now, but my fellow Texans who've been unable to avail themselves of the healthcare system because it's so badly broken. Under Obamacare, I've had constituents who are unable to go to MD Anderson when they had the same diagnosis that I got. That's not coverage. That's not care. That's fake care and fake coverage, and that needs to be resolved. And it can be resolved if we do one simple thing, and Eric alluded to it, and that's focus on patients and doctors, not insurance companies and the lobby in this godforsaken town. The fact of the matter is more money is spent on healthcare lobbying than anything else, 6 or 7 times what is spent on defense lobbying. You want to know why you don't have healthcare freedom? Don't look any further than the lobby interest in this town. It is time for us to stand up and defend the American people against the lobby interests for big insurance and big hospital and big pharma who are standing in the way of the American people being able to get the care that they deserve. And it starts with legislation like my friend Eric has put forward, or legislation that he alluded to as a part of that I introduced in 2019, the Healthcare Freedom Act, or 2022, the Personalized Care Act with my friend Ted Cruz in the Senate, variations of the same bill. And the point of it's pretty simple. You should be able to go to the doctor of your choice. You should be able to go to direct primary care. You should be able to go to health sharing ministries. You should be able to have freedom to be able to go get the care you deserve. And you should be able to have that in health savings accounts, and they should be equally tax advantaged. Why do we make this to where big companies get the tax breaks and insurance companies control what you get to do? Change that. Change it right now. And we can do that. We can do it in Reconciliation 3. We can do it if we just have the willpower to do it. And I'll say one final point before I turn it over. We're not going to do this unless we stop worrying about figuring out the fake math that the CBO and JCT are going to tell you this costs. That's all driven by the lobby. The lobby in this town doesn't want change. So they're telling you that it's going to cost a fortune for us to do what we should do, which is give people freedom. So you want to put money in a health savings account. You want employers to put that money in a health savings account. You want to be able to use that across multiple options. That's not going to cost, that's going to save. So don't get caught up in the pay-fors on this. I say that as a fiscal hawk who's going to demand that Reconciliation 3 be paid for. But on this point on healthcare freedom, the principle is simple. The patients and the doctors come first, not the insurance companies and the lobbyists and the bureaucrats in this town. That's what Eric's standing up for. That's what this alliance is about. We can reclaim healthcare freedom if we have the willpower to do it. Now in this bill, or generally, it's time for House Republicans to stop being afraid of healthcare and run on healthcare. Stand up in defense of the people. You want to know why you can't afford things? Healthcare. You want to know why families are hurting? Healthcare costs. Let's fix it right now. We have the willpower to do it. We can do it. And with that, I'll now introduce my good friend Troy to come up here and add a little bit more. Thank you. God bless.
Well, thank you, Congressman Roy, for those words, and thank you all for being here, and thank you for having me. It's an interesting problem. I agree with Congressman Roy there that this is a big problem, and one of the issues that we have that we're constantly dealing with is I have colleagues that are not willing to admit that the emperor has no clothes. The ACA has been now 16 years of adverse selection. So as it gets more expensive, young, healthy people seek alternatives. Concentrate the risk, the prices go up. Prices go up, it gets more expensive, you have a more adverse selection. In my personal opinion, this is going to collapse under its own weight if we don't do some meaningful reform. And some of the things that have really concerned me is I watch this. I came from a family of fairly modest means. My mom worked in a grocery store. And as a kid, she'd take me to the doctor, and as we walked out, she'd go up to the front desk, and she'd get out her checkbook, and she'd write a check. We didn't have insurance, but that private practice was priced for that community. And my mom, as a grocery store clerk, could afford to pay those costs. That's completely gone. We're making it harder and harder for people to even for providers to be in private practice. We need to reestablish that patient-provider relationship. And so many of the things that we've seen, even like price transparency in hospitals, the problem is most consumers don't care because somebody else is paying the bill. What happens if you expand health savings accounts, if you have HSAs so that they're not tied to a high deductible employer plan, that you can actually have tax effective money there to make your own decisions, and that those are finite dollars, you're going to start asking. You're going to start asking about those prices. You're going to start asking about those services. If you go to a doctor and they say, we've done a test and it's 95% sure that you have this, but for another $20,000 test, we're going to be 100% sure. If somebody else is paying it, you're going to go, heck yeah, I want that other test. If you're paying it yourself, I'm pretty sure that, the first diagnosis was right. You're going to move on. You're going to start dealing with those prices. We need to get back to that point where private practice can thrive, where you can reestablish that patient doctor-provider relationship and start thinking about those things. Get consumers, put them in control of their own healthcare costs and their own decisions. I think that there's an incredible amount of meat on the bone. There's other things out there that I want to talk about. Any of you, go talk to your hospitals, your providers in your state, and ask them about Medicare Advantage. The problem is I'm a former regulator, and CMS, the Center for Medicare and Medicaid Services, was always kind of a black hole for me. And they had ideas about network adequacy in Montana that didn't work, and whenever I had Joe Namath or Jimmy Walker selling MA plans in Montana with either inadequate or zero network, there was nothing I could do because I did not have the authority to do that. So another thing that I'm hoping to get into reconciliation, because I think this would be a huge savings on fraud, is give states the ability to enter into collaborative enforcement agreements with their state regulators. Because the state regulators, they care about the people in their state, and they're going to pursue that, and they're going to start fighting that fraud. There are so many things that we need to do to fight this fraud, to give the people what they want, give them access to health care, reestablish that patient-provider network, and really take this on. Because as I started this out, after 16 years of adverse selection, this is going to collapse under its own weight. We need to do something. We need to do something now, and we need to convince those folks that are in opposition that the emperor really is not wearing any clothes right now, and we need to do something about it. On that, I want to thank you all for giving me some time. Thank you. And I'm going to introduce an esteemed freshman colleague of mine, Congressman Barrett.
Thank you, Troy, and Rep. Burlison, thank you for introducing this. I was proud to co-lead the introduction of this bill because it is a real milestone of reforming what we have all lived with as the status quo for far too long. A broken healthcare system that doesn't put Americans and American families in the driver's seat of what we need to see to improve our health outcomes. If the system were working right now that we have, people would appreciate it. And if you look at people's opinions of the American healthcare system right now, you will see that they are highly, highly frustrated and extremely dissatisfied. And the outcomes of that are chronic disease, worse health conditions, worse off, and financially poorer as a result. And this is a major reform that we're introducing to bring this to the forefront, to really challenge the status quo. I think if you want the easiest job in Washington, D.C., you could be a lobbyist for the status quo, because it is so hard to change anything. You heard from Chip Roy about the institutional effort to prevent any changes from happening because there are people benefiting from the broken system that we see right now. They're profiting off of it. They are getting richer while Americans get sicker. We have to change that. The only thing lacking to get this done is the willpower here in Washington, D.C. from members of Congress to challenge that status quo and make changes. We're giving HSAs to every single American. We've talked about no taxes on tips, no taxes on overtime, no taxes on Social Security, no tax on health care. Add that to a pillar of what we need to do to save Americans money, put more investment into their pocket, that they can choose the health care plan that works the best for them. Direct primary care options so that you can build a relationship with a provider that cares about your health outcomes. Allowing health savings accounts to pay for things that are preventative in nature, whether that's a gym membership to go get into a fitness routine, whether it's a fitness device that you can track your mobility and what you're doing throughout the day, or something I'm very excited about, healthy groceries. We all know that a product of what your health outcome is really dependent so much on what you put into your body and what you eat. So these are very innovative ideas we are trying to do to empower ordinary Americans and American families to take control of their health care, save money, challenge the status quo, defeat the big interests, and actually make America healthy again. So thank you so much. Thank you for allowing me to be here to help champion this legislation. I look forward to us working this through the rest of the process. So thank you.
Next, I'll invite my dear friend Victoria Spartz to make a few comments for a couple minutes. Thank you.
Thank you so much. Thank you. I'm going to echo my colleague and say, if you want to have the best job in Washington, D.C., you need to be healthcare lobbyists. This is trillions of dollars of defrauding the taxpayer. And sadly enough, our healthcare system now is creating it's like a weapon of mass destruction. We're destroying country fiscally. One of 6 families is bankrupt because of the medical debt. The states are go bankrupt, the federal government is bankrupt. And we have some of the worst outcomes in the world from developed countries. This is unacceptable. If you don't have a healthy nation, if you don't have finances, you're not going to be a strong country. So we have to have solutions. The solutions that were brought up, to get our problems on steroids and Affordable Care Act, Obamacare, now is blowing up the system. So we will have a full government takeover of health care, as some of the Democrats want. It's going to be cheap, but it's not going to be pretty, and I think it would be very bad for the American people. So I appreciate my colleagues willing to show solutions, because the solutions will be bringing back competitions, bringing transparency, and competition for value. And we will have to reform the system, because this is the biggest issue that we're facing in the country. If we don't save health care and if we don't reform it, we are not going to exist in the country. This is a reality, and it's a very tough reality. We have healthcare cartels making enormous amount of money right now. If you think about our spending before COVID, we were spending $4.5 trillion per year. Now we spend $7 trillion. It's all healthcare, and we are not getting healthy. It's a slush funds full of corruption. So I think we need to have these reforms. reform must happen. I hope we'll do some of them, like including price transparency. This year, President actually had his State of the Union address. He supports this issue. Should be bipartisan issue. Committee had hearing last, few weeks ago. So I think we need to get it moving and maybe pass. And if my Democrat colleagues talk about transparency, let's see how they're going to vote. Because everyone talks about transparency. Let's put it in the floor. Let's see who's going to be against transparency. At least people know how they're getting screwed, okay? And then we're going to actually do some real reforms for competition. So I appreciate the solutions. I'll be in the trenches fighting for you. I always say I pick my hills to die on, but this one we have to take it for the American people. So thank you so much, and thank you for having me.
And I want to introduce someone I did not have the honor to serve with, but has served our country well, former Representative Holtgren from Illinois.
Thank you so much. Thank you, Congressman Burlison. My name is Randy Holtgren. American families deserve health care they can afford and health care they can choose. When I served in Congress from 2011 to 2019, members of Congress had to be on the Affordable Care Act. My family lived back in Illinois. It didn't work for us. It was a nightmare. I am so grateful that I found a health care sharing ministry at that time. I dropped off Obamacare with my family. We joined a health care sharing ministry about 14 years ago. It was one of the best decisions I've ever made. I now have the privilege of being the executive director for the Alliance for Healthcare Sharing Ministries. There is affordability in healthcare sharing ministries. We've saved literally, I would say, over $100,000 since that choice we made about 14 years ago on our healthcare coverage. And we know when we're sending checks to other families around the country for healthcare, it's going to real healthcare needs. It's not going to huge bureaucracies of insurance companies. It's going to real families for real healthcare needs. So this affordability is so important, but also parity. It's not fair that families who are taking care of themselves, making good choices, being part of these healthcare sharing ministries, don't have tax parity. And so this is a great opportunity with the Congressman's bill and others' bill to open up that tax parity, also to open up the ability for us to be able to use health savings accounts to be able to pay for other people's needs. It's the right thing to do. It's, again, I think what communities used to be, where we used to look out for each other and care for each other and pay for each other's needs. That is what healthcare sharing ministries are all about. So thank you, Congressman. Thank you, Keith, and all of you for your support on this. This is so important. Mr. President, we call for you, members of Congress, we ask you to do the right thing for the American people. And for right now, it's the right time to make sure, once again, American families can have health care they can afford and that they can choose. Thank you so much.
And now we have Daniel Kowalski.
Yeah, that's me. And hi, I'm Dan Kowalski. I'm the director of the Herman Center at Heritage. So Heritage put out a special report earlier this month on Reconciliation 3.0. The president of the foundation has been a big fan of using reconciliation for reform. He's been on this for months now. And so we put out a special report recently with a number of ideas that could be used to reduce the deficit, provide pay-fors for this kind of effort, and even some things related to healthcare. For example, we're all about having premium tax credits be handed into an HSA so that people have the freedom to be able to buy what they can. We'd pair that with getting rid of silver loading. Right now, insurers are profiting off silver loading. We should reform the system. Other things we say you should do is you should have if you find savings by shopping through a robust price transparency regime, as a consumer, you should be able to get a cut of those savings. You can't get that right now. Right now it goes to the insurer gets hit on their medical loss ratio, and if it does happen to make its way to the enrollee, they get taxed on it. That's a crazy system. We should change that kind of thing. So other things we had in our special report first I'll say this. We think you don't need to reconcile a whole bunch of committees. We think you can get a decent reconciliation bill by just 4 committees in each chamber. Our position is that you should get reconciliation done before the August recess. You need to get all these things done now. And you reconcile ag, energy and commerce, financial services, and ways and means in the House, you can have a decent bill. In the Senate, that'd be ag, banking, health, and finance. So how are we going to do these savings? We'd come up with $1.5 trillion. Part of it is by, a big part of it is by ending Federal Reserve interest payments on bank reserves. Right now, the Federal Reserve pays banks for putting money idly, doing nothing. We pay a competitive interest rate, and that actually attracts reserves from foreign banks. A good chunk of the money goes overseas. The Federal Reserve, the entity that prints money, does not run a profit, in part because of the interest that they're paying on reserves. So we have a new Fed chairman who says he cares about the balance sheet growth. The balance sheet grew at the same time that we were paying these reserves. Let's change that policy. Right now, the interest that we'd be expected to pay over the next 10 years is $1 trillion. We think you should do more about the work-capable, low-income adults, the 138% and below poverty on Obamacare. The Democrats had a every state is in or every state is out on Obamacare. Let states choose. Let states choose who they want to put into Obamacare, who they want to cover in the Medicaid population. There's several $100 billion of savings by allowing states to do something like what Arkansas does now. We'd enhance the anti-fraud provisions of SNAP. You have categorical eligibility. You get a brochure regarding TANF. You may be eligible for food stamps. But you might have $1 million in the bank and you're on hard times temporarily. So we say you should have to have some sustained hardship before you're able to get food stamps. Simple thing. Remittances. If you are here deportable or not authorized to work, why should you be able to send money back home? You're doing something illegal. We think we should stop that. It's not necessarily a big money raiser, but it's something that is good policy that you can do in reconciliation. And it also supports President Trump's recent EO to improve the security of our financial system. And the last thing, and one of the reasons why you need to do reconciliation now, relates to Planned Parenthood. Planned Parenthood was defunded for 1 year in the One Big Beautiful Bill. That expires on the 4th of July. It's something that needs to be done. It's one of the reasons why we at Heritage say speed is of the essence in getting Reconciliation 3.0 done. It's a time for doing health reform. It's a time for doing things that we may not have an opportunity to do again for a while. And I appreciate the opportunity to present our ideas today, and we support your ideas. Thank you.
Thank you. We now have Hannah Anderson.
Hi, good morning, everyone. It is a beautiful day to be talking about Patients First Healthcare. Although I'm telling you, if I'm here much longer, I'm going to start turning the color of this dress because it's a solid Scandinavian and my skin can't handle it. But it's such a pleasure to be here with so many Patients First advocates, Patients First colleagues, and policymakers, because we all get to be here today to celebrate the advances that have been made in Patients First Healthcare. And you know what? No president who has fought more for patients than President Trump. You know, patients didn't know how much they were paying when they went to the doctor, and President Trump changed that. Patients didn't know what options they had at the pharmacy counter or how much they were going to pay when they got to the pharmacy counter, and President Trump changed that too. Patients were getting ripped off by freeloaders here and abroad, and President Trump changed that. And under the great healthcare plan, which we all get to be here to talk about today, patients can achieve even more. We can finally get full transparency into costs from both our health providers and our health plan. We can get full accountability from the middlemen, and we can get lower healthcare costs. And most importantly, we can get our healthcare dollars back. And so Patients First policymakers, again, like the ones here today, understand that taking back your health isn't just about healthy eating or healthy living. It's also about taking back your health dollar. Because how are you supposed to make good decisions for your health if you don't have control of your healthcare dollar? So when patients can control their health dollar, they can finally take back their health and spend that dollar on what helps them be healthy. And you know, families are suffering. So for a family in DC with 2 children, a plan can still mean thousands of dollars in premiums and a $10,000 deductible before coverage really helps, which is exactly why this family will skip care. They don't have the options they need. They don't have the flexibility with their health dollar, and comprehensive coverage ends up being a really unfulfilled promise. And this is the story of so many in the United States. The Great Healthcare Plan offers a way to make care more affordable and accessible by giving people their money back. And so today at the America First Policy Institute, where I lead our healthcare policy, we released a paper, 5 papers, showing people and policymakers what we can do to actually give people more flexibility, more control, and their prices to really achieve the president's vision for a great healthcare plan. Thank you so much. Appreciate it.
Katie Talento.
Thank you, Congressman. So if the MAHA movement's taught us anything, it's that healthcare is a winning issue. And the American families, they care. We care. Moms like me, we care. Grandmothers like me, we care about the crushing impact of illness, chronic illness, that basically got President Trump reelected. And thanks to the wonderful collaboration with Secretary Kennedy. And so I want to talk a little bit about that today. You know, I used to work in the White House in the first term, and I have the scars on my back from Republican failures to repeal and replace Obamacare. And for too long, Republicans, you know, everyone said, y'all just want to take healthcare away from us. That if we said the word healthcare, we lost an election. Because that's how the voters viewed us. You just want us to save more for healthcare. You're just going to give us Obamacare, but a little less. And they were right. That is what we were advocating for. But that has all changed. People are sick and tired of these giant industry interests. And, you know, people ask me a lot because I've been lobbied by all of them for 20 years. Who are the biggest Bond villains in healthcare, in the healthcare swamp? I'll tell you who it is. It's PBMs, it's the fake charity hospitals that are raping and pillaging their communities, it's the carriers, and it's pharma. So I'm just going to tell you right now, it is great to hear these members of Congress behind me saying, screw the lobbyists, we're done with that. If we don't go big, we're all going to go home. And so it's about time that we take the opportunity of a reconciliation. This is a gift from heaven that, you know, founding senators once gave us, founding members of Congress gave us in the budget process. And if we don't use it, we are the dumbest and we don't deserve power. So this is something we have to do, y'all. And, you know, when I got out of government, people with my resume, they go and they just shill for some disgusting industry interest. And I looked around, I just couldn't do it. And so what I do today is I build health plans for mid-market employers, a few thousand, a few hundred employees. And the only way we can save them money and increase their benefits is to fire the PBM, fire the carrier, and avoid hospitals like the plague. We give them concierge direct primary care. We give them beautiful hand-holding white glove navigation to the highest quality and the lowest cost sites of care. How can we do that without transparency in pricing? We can't. And too many of these hospitals, they are lying. Too many of these carriers are putting out garbage data. I was so relieved to see the secretary last week talk about tougher enforcement, finally, against these loser hospitals that are trying to screw over patients and chase and pursue and send their patients to debtor's prison. It is about time that we stop, you know, messing around. I will use no 4-letter words here. Stop messing around with these interests anymore. And I'll tell you, this industry, it is a fifth of our economy. It is eating our economy. It is stealing the American dream from the middle class. And I stand so proudly with all these people here. You know, I'm old enough to remember when Republicans thought that, tax cuts were not government spending. Remember when we weren't afraid to worry about pay-fors when it came to tax cuts? Democrats used to give us all kinds of grief for that. Now we're so worried about paying for tax cuts. Healthcare should be tax-free. The president he intuited all this policy. He intuited it back in November when he put out on True Social, we need to take every dollar away from the big insurance companies and give it to the people. That's what all of us are standing here today to promote. I'm proud to stand with them. And I call on Congress, use the power that you have, or why are you even here? Thank you.
Wow, that was fantastic. Next we have Lauren Stewart.
Good morning. I'm Lauren Stewart with Americans for Prosperity, and on behalf of our thousands of activists and communities across the country, I want to thank the Great American Healthcare Alliance and Rep. Burlison for bringing us together to talk about what remains a top 3 issue for American families: healthcare. And I mean healthcare, not health insurance, because the two are not one and the same. At Americans for Prosperity, we believe all Americans should have a personal option in their healthcare. Something that fits the unique needs of their families, not a one-size-fits-all system designed by government or dictated by insurance companies. Our communities reflect the full American experience. We have veterans, small business owners, minorities, moms, dads, grandparents, and young people who are just starting out. And too many of them are boxed out of some of the wonderful health tools and key access points that would actually work for their lives. The encouraging, though less mentioned news, is this administration and Congress have taken historic steps to take power away from bureaucracies and shift it back to patients. The major reforms in the One Big Beautiful Bill, no, not the reforms in Medicaid, but the expansion of direct primary care, the historic expansion of health savings accounts to millions more Americans, are giving families real control over their health care, and they're wildly popular. Both of these issues pull across party lines at 80%. That tells us Americans aren't divided on this, they're united, and Congress should be too. In my house, growing up, there was a simple golden rule. He who has the gold makes the rules. So my dad always got what he wanted for dinner. And right now, in American healthcare, the government and insurance companies hold the gold, deciding what care you get, how and when you get it, and what it costs. The president understands this and has encouraged Congress to expediently solve for this. And this is where solutions like Rep. Burlison's plan are so well positioned. By putting patients in control of their own healthcare dollars, correcting incentives and lowering costs. Because at the end of the day, moms and dads, not bureaucrats, know what's best for their family's care. I also want to thank President Trump for speaking plainly and effectively about healthcare in a way that has resonated with the American people. When leaders talk about healthcare and the way families experience it, people listen, especially when their exact feelings and pains have been echoed. As we look ahead, we encourage President Trump and Congress to keep building on this momentum. The conservative-led health policies, like Rep. Burlison's Great American Health Plan, are meeting the moment for what Americans want in their healthcare. The narrative that there is no plan can and should be squashed with solutions like this and solutions that have been signed into the law, and more solutions that exist on Capitol Hill to empower families in their health care. Americans for Prosperity would and will support any initiative to advance a personal option for all Americans in their health care, and we're happy to continue with Congress and this administration to make it happen. Thank you.
Next we have Dan Perrin.
Thank you, Congressman, for putting this together. And thank President Trump for putting health care back on the Republican agenda. If he hadn't been so insistent on, as Talento put it, intuiting the idea that the money needs to avoid the insurance company and go to the individual, we wouldn't be standing here today. And that idea goes back to the start of the HSA movement. HSAs were designed to take money that would have been going to an insurance company and instead put it in the pocket of the individual. The way you would do that is you would increase the deductible and it would lower the premium, and that lower premium would create the savings that you would put into the account. So literally money that was going to the insurer would go to your savings account so you could meet the higher deductible. If you drop the premium by $4,000, it freed up $4,000. That would go into the savings account, and if you had a $3,000 deductible, that $4,000 would pay the deductible. So really, we've come full circle with President Trump's idea of putting money in the pocket of the individual. And the point of that is that you spend money differently if it's your own. So if I go on I'm a Republican healthcare lobbyist, by the way. And if I go on a dinner and somebody else is paying for it, I'll order differently than if I'm paying for it. And that is, in essence, the idea of a health savings account. I have 6 kids, and when I'd go to a amusement park, when I was a young father, I would give them each $25. That's for the day. They'd come back with cotton candy all over their face in 2 hours saying, "Dad, can I have some more money?" So I decided to change that and say, here's $30, and what you don't spend, you can keep. And so the record was, one of my daughters spent $2 on a drink, kept 28. So that's how what President Trump is talking about, empowering the individual, actually works in the economic reality of healthcare. And what we're really doing is we're increasing individuals' buying power by their tax bracket, by their income tax bracket. Some people don't pay income tax, but everybody pays FICA. So you get a tax break for the money to pay your deductible. And let's face it, the ACA is designed with a bias in mind: give money to insurers. If you look at some of the deductibles in the ACA now, 10, 9, 8, 12, $16,000. And nobody's got that money just lying around. So we need to help people in Obamacare, in the ACA, by giving them money to be able to meet these really high deductibles. Now, I'll just say one more thing about the idea of a high deductible plan and why we've got to divorce it from an HSA. Back in the day, nobody had a high deductible. Now everybody has a deductible that will meet the minimum HSA requirements. But because of the plan designs, only about 10% of people actually qualify to be able to open an HSA. So when Uber did a test in Austin about drivers being able to tip into passengers being able to tip into a driver's HSA, hey, I'm saving for my daughter's braces, can you put your tip into my HSA? There were only 10% of the drivers who were qualified to have an HSA. So this is all being tied back together with the opportunity of reconciliation. And our position is reconciliation should be as big as possible. The precedent has already been set for appropriations. If we're in a shutdown, let's do all the appropriations in 3.0. That way we can make sure the government's funded during midterms. So our position is reconciliation 3.0, a go-go as big as we can. Thank you.
And then, I'm here to answer any questions. Keith, I don't know if you want to answer questions.
You can answer any questions. No questions. Everything was so perfectly stated that there's no questions. I'd like to thank some of our team members, Ashley, Liz, Grace, for making today happen, Leland for really working the phones on this one. But we thank you for coming today, and especially the Weather Committee has been outstanding. And we look forward to answering your questions later. Thanks.